Hello everybody, welcome back. This is Dr. Mark Zuperi, plastic surgeon, Visage Clinic in Toronto, Canada. I want to talk to you about one of the first body implants I've ever performed and been performing for 22 years after that, calf implant. Calf augmentation is one of my first implants I performed in 2001. I learned from the expert at the time, Dr. Carlson, and calf implants have become an important part of our practice for both male and female. Most people believe calf implant is only for guys, but I will shock you now, 50% of our patients are female. Now, patients who come here for calf augmentation come with different requests. Some patients want bigger calf. Our males, often, occasionally females, want to have that muscle look. They want to have the bulge. They want to have an increased size in circumference, and those will have those implants. The calf augmentation implant, they come in many sizes, many width, and many length. So depending on the patient's anatomy, depending on the patient's desire, we will choose an implant. They are all silicone solid, but very, very soft. There's no gel, they cannot leak. They're all inserted through an incision behind the knee. Calf muscles have two heads. So the gastrocnemius muscle has an inner, medial, outer, lateral head, and we can augment both, but preferentially at different times. Now we have patients who come and they have one calf smaller than the other. We see this commonly after trauma, after repair of an Achilles tendon laceration, after clubfoot surgery. We have it after polio infection, usually in third world countries where polio still exists. They come and there's absence of muscles on the inner part. We also have our ladies who have very, very skinny inner lower leg, and they're kind of self-conscious to show their legs. Sometimes we have a bit of a bow leg look to the legs. So we also have an implant that's longer for our ladies who want an augmentation from knee to ankles. Those implants are all inserted under fascia. Fascia, again, is that white layer, thick, strong layer over every muscle. So basically we go behind the knee in the crease, so very hard to see when it's healed, the incision. I go inside, find the fascia of the gastrocnemius, open the fascia, and gently create this pocket under fascia where the implant is easily inserted inside the leg. The incisions are closed with stitches, some internal, some external. I do use a drain for a few days to prevent fluid from accumulating around the implant. The recovery is about 5 to 10 days where there is tenderness and there's a bit more difficulty walking. Although there is no cut into the muscle itself, there's pressure over the muscle, which gives a bit of tenderness post-op. Many patients will use crutches for a week or so, mostly for pain management. Now, for return to non-physical work, most patients within a week or two can return to work. For physical work, we require 4 to 6 weeks prior to strenuous physical work and 3 months prior to returning to physical activity involving the lower legs. In 3 months, your body will form a layer of collagen around this collagen capsule. It does so with all facial implants, with pec implant, with breast implant. It's all the same. The body forms a layer of collagen, which after 3 months will secure the implant in position. Calf augmentation is a very successful procedure. I always warn our patients that initially it's not as big as they hoped for, because once we put the implant inside, the implant will be kept in place by this strong fascia. It will compress the muscles slightly. It will be lesser of an augmentation initially. And as the body heals, as the muscle returns to its original strength and shape, the fascia will slowly expand. And yes, common question patient asks, can they still grow their muscle after this, after pec augmentation? Yes, the patient 3 months later can return to the gym, can continue to grow their muscle, and the implant will just be pushed outward and the fascia will continue to expand. Calf augmentation is a very common practice procedure in my practice. I've been performing calf augmentation since 2001. We do several procedures every month at the Visage clinic. And yes, male and female seek calf augmentation. Thank you for watching. Have a lovely day.